Okay, done. Go on.
Good evening, everyone. Hello. It is our pleasure to welcome all of you here in our second session of Journal Club, our series of journal clubs we have under the Research Committee of Egyptian Society for Medical Education. The coordinator of the research committee is Dr. Angie Abu Zaid, Associate Professor of Medical Education at Faculty of Medicine, South Carolina University. Today, me and Prof. Hinda Bulata, we are the coordinators of Journal Club team at the umbrella of Egyptian Society for Medical Education. We are running the Journal Club session. Today, our session is about professionalism topic. As by rule, that the first session, always we introduce the concept of professionalism by explaining the underlying concepts and presentation of EMI guide. And this is done by from 1 month ago by Professor Hinda Bulata. She gave us an interesting session and amazing. And I encourage every one of you to visit our YouTube channel. Inshallah, it will be posted for you in chat, and subscribe our channel and listen to all journal club session and all training session we have. Everything is uploaded on this Egyptian Society for Medical Education YouTube channel. So I invited all of you to join our channel and subscribe and do like for our videos and listen to the previous session. Today, our session to do a critical appraisal for for two researches related to the research topic of our journal club session. Last topic was about professionalism, as I mentioned. So we today selected two articles to be presented today by two presenters. The first presenter will be Dr. Maha Ayman. She is lecturer of pathology and the coordinator of research ethics committee, Dubai Medical College for Girls, Dubai, United Arab Emirates, and she has master degree in pathology and master degree joint health of profession education master degree between South Carolina University and Maastricht University. The floor for you, Dr. Maha. You are available here. Today, Dr. Maha will present for us one of the two research articles. She selected one article and she sent it to the team of Journal Club. And we did selection with her for this article. Her article is about peer assessment of professionalism in undergraduate medical education. And she will give you more details about this article. Okay. Floor with you, Dr. Maha, and you have 20 minutes to present your presentation. Thank you. Thank you for all attendance.
Thank you so much, Dr. Asma, for your introduction and for inviting me. Today, our research is talking about introducing peer evaluation to assess professionalism in undergraduate medical students. Authors are Vernon Corain, Nicholas Fairbridge, and Diana Deacon. It was published in BMC in 2020. So the introduction is talking about the importance of assessment of professionalism in undergraduate medical students, and it talks about using peer assessment as a possible alternative method for providing formative peer feedback to students regarding their professional behavior. Aim of the work is to use peer assessment as an professionalism assessment among pre-clerkship medical students. The objectives: number one, to introduce same peer assessment of professionalism in pre-clerkship undergraduate medical students. Number two, to evaluate suitability of adopting a professional behavior scale for longitudinal tracking of student development. Number three, to evaluate student comfort and acceptance of peer assessment. Or if you allow me, I will skip these two slides because methods, results, and conclusion will be later discussed in more detail. And also this slide, I will start here. as peers are able to observe one another regularly over a wide range of circumstances. So peer assessment also provide information regarding student performance that is not measured by other traditional evaluation methods. Also engaging in peer feedback may also increase student motivation by fostering a greater sense of accountability and ownership of learning. Students prefer peer assessments that are conducted in a supportive environment, are anonymous, provide immediate feedback, focus on both unprofessional and professional behaviors, and use the assessments formatively. However, despite the benefits of peer assessments, few successful peer assessment systems have been implemented, and a reluctance of students to participate in peer assessments have been noted. I will read the main research questions. Number one, does a professional behavior scale previously validated for cross-sectional use retain validity and reliability for longitudinal peer assessment of professionalism among undergraduate medical students? The second question, what are the educational benefits of peer assessment of professionalism in pre-clerkship phases of undergraduate medical education curriculum? Third question is, what is the perceived educational value for peer assessment of professionalism among undergraduate medical students? The study design was a mixed cross-sectional and time series evaluation. The sample was undergraduate medical students in the Memorial University of Newfoundland in all phases of medical education. And the duration of the study was 3 years, 2017, 2018, and 2019. The study included 3 phases. Step 1, they distributed a cross-sectional survey in early 2017 among all undergraduate medical students across all phases to identify perceived barriers to peer assessment program acceptability and implementation. The survey findings were then used to inform the design of the peer assessment system and its introduction in the undergraduate curriculum. Step 2 was longitudinal peer assessment program beginning in 2017, repeated again with classes entering in 2018 and 2019. The evaluation involved an aggregate summary and analysis of peer assessment scores across these 3 class cohorts at 4 time points, reflecting the 4 semesters of clinical skills held through phases 1 to 3. Step 3 was finally the evaluation of the student feedback after implementing the peer assessment of professionalism. And this was done at the midpoint and end of the program. The statistical analyses that were included in this research were means, medians, and standard deviation, and the exploratory factor analysis, Cronbach alpha, interclass correlation, Friedman test, and Wilcoxon signed rank test. The ethical approval was by the Institutional Ethics Board and the Health Research Ethics Board in the university. So, till now, did the study address a clearly focused issue? What's your opinion? Can participants talk now, Dr. Hind? Or I should proceed?
Yes, Dr. Maha, yes, and we encourage all the participants to interact with Dr. Maha for the critical appraisal for the previous section, if you don't mind.
You can participate through chat option, or you can raise hand and we can give you chance to speak. The first question in our critical appraisals, as presented by Dr. Maha, is regarding, does the study address a clearly focused issue? What do you think? This is the first question. We can use the chat option, please, or raise hand. Yes, we have received from Dr. Halima Yassin that this study addressed a clearly focused issue. Okay, Dr. Maha, go on.
Okay, thank you. Second question, was the
Dr.
exposure
Soha also.
accurately?
Yeah.
Okay.
Mm.
Was the exposure accurately measured to minimize bias? What do you think? Any ideas? Any opinions?
يعني what granting from the research team to decrease in bias in selection or bias in everything, in sample calculation and everything. What do you see about this research, about this part presented now by Dr. Maha? Or you can give your own, Dr. Maha,
Okay.
your own reflection about the article.
Yes. So I was not sure
Mm.
because no definite inclusion criteria. They mentioned all phases, but they wanted to focus on pre-clerkship. So, yeah, I have problem with this area actually. Did they
Again?
include all phases? يعني they
Yeah.
said in the beginning that they included all phases of the students,
Mm.
but their objective was to assess the using of peer assessment in the pre-clerkship students. So it's not all phases, يعني.
Yeah. Okay, but I think the question also need all different kind of bias. I agree with you, but here they have many areas they did for decreasing bias. One of them mentioned that Dr. Halima mentioned that they are doing their study over many years, so they did it as well. Plus selection, they did some kind of statistical analysis, as you mentioned, like exploratory factor analysis, Cronbach for decreasing reliability, يعني for measuring reliability of survey, and so all of this can
Minimize bias.
يعني minimize different kind of bias. Okay,
Okay.
go on.
Was the outcome accurately measured to minimize bias? I think you agreed, according to Dr. Halima also.
Yeah.
Okay. Have the authors identified all important confounding factors?
Mm.
What do you think?
Any feedback from any one of you? Do you see that these authors identified all the confounding factors of this article? We need your input about this point. You have 3 options to select: yes, not sure, no. And if yes, please say what is the evidence for that, and if no, also give us rationale. Okay, Dr. Maha, you can give your own.
I said not sure, يعني I didn't find a lot of يعني confounding factors in the paper.
Yes, if I agree with you. Okay.
Okay, so the next question is same. Have they taken account of the confounding factors in the design or analysis? They taken account of what they considered, يعني some factors that they mentioned, but yes. Okay, was
Yes.
the follow-up of subjects complete enough? And was it long enough?
They follow them for 3 years all over the
3 years.
study. Yeah.
Yes. On 4 time points, according to the semester of clinical skills.
Okay. So you are not sure?
I'm not sure because they didn't include the clerkship student. Yani, this is the same problem for me in this research.
Okay.
Okay.
Because peer assessments are concerning undergrad without clerkship. Maybe the clerkship not including any kind of evaluation. So no chance for peer assessment. Maybe because of that they exclude the results of clerkship. They evaluated the clinical skills from the student at the peer assessment. They use the peer assessment in different years without this clerkship. Maybe because of that they didn't mention the clerkship.
Yes, you're right. Okay.
Last question.
Yeah, was it long enough? I think
Yeah.
it's good to have 3 years
Yes.
study. This is
I'm
long enough, I
agree.
think.
I'm agree with you.
Okay.
Okay.
Okay, so now the results for step 1, that was taking the feedback from students before starting the program. Response rate was 47.8%. Vast majority, which is 80.4% of students, supported a totally anonymous peer feedback. Although some of them يعني suspected that it will be anonymous because the peers will be in their small group. يعني it will not be 100% anonymous. يعني this is the concern that they raised. Student respondents supported only the assessed individual having access to the feedback in 89.5%, and most, which is 81%, supported its use as formative assessment. Students were also supportive of assessing professionalism in 86.3, leadership 71.2, and performance in small group activities in 70.6%. Majority of the students were supportive of classmates from small group learning sessions providing peer assessment, 66%. Then step 2, when they started the longitudinal assessment of professionalism. 241 participating pre-clerkship medical students submitted 2,756 peer assessments, with the largest missing data or non-response was for the item asking whether they would refer this future physician to a family member, representing 19.2% of all missing data. And according to Danifer et al., this item was dropped based on the degree of missing data and negative student feedback. Perfect score of exceptional across all the 15 items were recorded in 1,180 assessments, representing 44.6% of all peer submissions. These are the questions, the 15 questions that were included in the peer evaluation. Consistently well prepared, identify and solve problem. يعني no need to read them, but just have a look. Then they did exploratory.
Please, Maha, again back to the survey to have a look about what the students use to evaluate their colleagues in peers evaluation.
Yes.
We need all our participants to concentrate about the different items of evaluation they use.
Yes, they assessed the preparation, consistently well prepared, identifies and solves problem, clearly explains reasoning processes, demonstrates respect, seeks to understand others, takes initiative, shares information with others, seeks responsibility, asks for feedback, trustworthy, admits mistakes, dresses appropriately, behaves appropriately, thinks and works independently, would refer family member to peer.
Okay.
Okay. Then they did exploratory factor analysis to find the correlation between the work habits and interpersonal habits. And there was a moderate to strong correlation between the two scales as following. These are the same 15 questions. And then they divided them into work habits or personal habits. And after making the factor analysis, they found a strong correlation between both scales. Okay. Right. Then they did two-way random interclass correlation analysis for consistency stratified by group size. This test was done to find the number of peer assessors that is enough to exceed reliability. And they found 6 or more peer assessors were required to exceed reliability targets with confidence. Then they did the Friedman test and the post hoc analysis. Okay. And this showed the change of the assessment of the students يعني over time. Okay, this is the time point 1, 2 semester and of the clinical skills of the pre-clerkship students. And here is the result. 69 students completed the, sorry, this is the step 3. This is not the one. Okay, it showed a significant increase in work habits scores between time points 3 and 4, with gradual progression between other points. And for the interpersonal habits, there was a significant increase between time points 1 and 2, and also between 3 to 4. So generally, the sub-skills demonstrated a capacity to track improvements over time, but they were limited by ceiling effects per item and thus per sub-scale, restricting the potential for further improvement to the upper limits of the scale. Then this is the step 3, which was the student feedback at the end of the program. So 69 students, which is to 28.6, completed the web-based student evaluation survey. And these were their responses. The ease of the process for conducting peer assessment was viewed favorably by the participants. And students agreed that the electronic rating system was easy to use, 91.3%. And the professional competence scale was easy to understand in 70 by 78.2%. The majority also agreed that they were adequately prepared, 67.2. However, 32.3% did indicate that they were not confident in their ability to rate peers, and 36.8% disagreed that their peers were honest and responsible in their assessments. Respondents disagreed or were unsure about the fairness of peer assessment, and many disagreed, 50%, or were unsure, 22.1%, on whether providing peer assessment improved their understanding of professionalism. A majority, 68.8, did not support the usefulness of peer assessment as a learning experience. Okay, these are the questions of the step 3 student feedback at the end of the program. I was adequately prepared to participate in the peer assessment. It was easy to complete the peer assessment using this soft Microsoft program or something online. The item on the professionalism scale were easy to understand. I was confident in my ability to rate my peers using the scale provided. I felt that peer raters were honest and responsible. Providing peer assessment increased my understanding of professionalism. Receiving peer assessment increased my understanding of my own professionalism. The written comments were useful for my professional development. The process of peer assessment was fair. Overall, this was a useful learning experience or not. Open-ended comments suggested students found the professionalism scale easy to complete and were encouraged by their peer assessment feedback provided. Students supported an educational focus on professionalism, expressed appreciation for the positive peer interactions and the reflective aspects of the assessment process introduced early into the program, but questioned the overall effectiveness or usefulness of the scale. Concerns were expressed regarding the functional lack of anonymity due to the small group size. Students scale items such as appropriate dress and lack of constructive feedback as limitations. While they acknowledged and appreciated the positive feedback, student respondents suggested such encouragement was less useful to foster formative improvement, and that negative feedback was avoided due to anonymity concerns within peer groups. So now, what are the results of this study? Can anyone tell us what were the results, in conclusion? What was the
Yes.
maximum
I think,
يعني
Dr. Maha, because they are using many stage of results and different kind of assessment methods of statistical test, it will be difficult for
okay.
all to memorize. One can memorize, but we can use chat option, and if you want mention one test or even one remarkable assessment, a statistical test, present in your mind after hearing Dr. Maha explanation about the results. Anyone can share in the chat option. What do you remember about this? She presented the many steps of results, many kind of statistical tests they use.
Yeah. If any result impressed you or were against your expectations. Because
What
for me, some
impressive.
things were against my expectations actually.
Perfect. Dr. Komal, we are happy that you are with us. She mentioned in the chat option that the main result was that participants liked the scale for competence and the system developed for peer assessment. The idea, and she likes the idea of using peer assessment as a kind of assessing professionalism, and also the using a valid scale. Thank you, Dr. Komal. Anna, any other point, remarkable results you see in this article? Anyone can participate, or we can ask Dr. Maha to give you the briefing. The journal club depends on you as attendance. We need you active with us, please. We encourage you to participate with us in the discussion. I think the most important point that they use, as mentioned by Dr. Kuman, the valid scale. Also, they do exploratory factor analysis to do kind of validity regarding constructive validity of the scales they use. Also, the satisfaction surveys they did to get the point of view of the student after this trial, and because they did it for a long time. But I think they are they must admit how they granting that there is no dropout during these 3 years of conduction of the study in the number of the student. I think they need to highlight this point. Okay, Dr. Maha, go next.
Okay, how precise are the results? يعني I think they were precise because they did a lot of statistical analysis and precise. I think the results were accurate.
Okay,
Okay,
Dr.
so do you believe the results? For me, I believe them actually. Anyone doesn't believe, please tell us. Can the results be applied to the local population?
I think they did in what school? One medical school.
Yes.
So you can do external validity. What do you think, our participant? This study conducted in one medical school. Can we do it as a representative for the local population of this country? No. Can't be applied because it is not a representative sample for all the population. Okay?
Okay. Do the results of this study fit with other available evidence? And what are the implications of this study for practice? So the implications, we can also see it in the recommendations and conclusion.
Yeah.
And for the other available evidence, of course, some evidence were يعني fitting to this, but I will show you a paper that have different things at the end.
Yes, go ahead.
Okay. So for the discussion, the successful introduction of peer assessment is dependent on a number of factors, including the type of method, a recipient, and how it is used, and issues surrounding the anonymity and confidentiality of the feedback. Anonymity is an important consideration and frequently mentioned way to encourage genuine participation in peer assessment and protect both the student evaluator and the peer who is being evaluated. Medical students are generally positive about peer assessment of professional behaviors, although the literature is mixed regarding student acceptance and satisfaction with peer assessment. And Papinka et al. Found students reporting feeling uncomfortable carrying out peer assessment, while Dooley and Bamford suggested that for many students, the idea of directly evaluating one's peers is at odds with traditional conceptualization of the role of peers. Studies also suggest that students' opinions are mixed on whether peer assessment should be informal and optional or formal and required. In the current study, they introduced peer assessment as formal but formative assessment. It has been suggested that resistance to formative peer feedback is less common than summative peer assessment, and student anxiety has been shown to decrease with time following early and repeated inclusion of peer assessment as they become more accustomed to doing it. The current study findings suggest that students perceived an electronic delivery format as a feasible and accessible means for administering, collating, and reporting peer assessment feedback. However, students' views appeared to change during peer assessment implementation, with students reporting on evaluation surveys a preference for facilitated guided face-to-face discussions of performance directly with peers. The study findings suggest that there was mixed acceptance of peer assessment of professional competence in pre-clerkship medical education. Students reported differing views of the value and usefulness of the process, whether that be a peer assessor and or receiving feedback from one's peer. The use of electronic means for administration, collection, and reporting of feedback was well accepted. While we did find improvement in the mean scores over time, the overall aggregate score improvements were limited due to a ceiling effect. Student feedback also suggested some uncertainty regarding the educational value of the process in enhancing professionalism. Students and faculty do need an appreciation for the purpose and use of peer assessment to become a successful mechanism for learning. Our findings do indicate that preparing students to give and receive feedback is a key aspect in the successful delivery of peer assessment. The learning advantages offered by peer assessment may be very beneficial over the course of medical education into professional practice, and longer term study of its effect does warrant further research. Recommendations in the students must be oriented to the assessment skills to be used in peer assessment and understand the process by which peer assessment will be undertaken. Instruction must also be provided to students on how to provide constructive feedback to one's peer. Peer assessment must be promoted to students as a positive learning and development experience that mirrors the responsibility that will be expected of them during their professional medical practice. Small group learning courses in which students are learning together in stable groupings for an extended period of time would be preferred to context for applying peer assessment activities. Students should be asked to engage in a reflective, summative assessment activity following the peer assessment process to enable reflection on the experience, learnings, and implications for future professional practice. And this is a paper that I felt that it is not fitting this paper too much. It is titled Peer Assessment of Professionalism Attributes. Here they said that the peer evaluation method found that all students participated. Okay, I will not read it, of course, but I thought that the results here were more positive because in our current study, most of the students at the end, they were not sure of the usefulness of the peer assessment. But in this paper, they felt that it is positively affecting their professional behavior and progress and so. Thank you. I hope it was useful.
Thank you, Dr. Maha, for your presentation. And the floor now is open for any remarks, any comments regarding this article about the discussion section, conclusion, recommendation, educational impact of the study, and any final remarks about the research work. We need to hear from all of you. You can use chat option or raising your hand to participate with us. What do you think about this article? We encourage all of you to, any one of you can kindly share with us their conclusion about this work, research work, and about the research idea, about the use the idea of peer assessment as a tool for formative assessment to assess professionalism. Any kind of remarks? I think the article is valuable and did a great effort as a research team. And they try to use a scale for assessing professionalism, valid scale for assessing professionalism by using peers. We actually in literature encouraging the use of peers in education, peer learning, peer assessment, and this professionalism component, if it is also comes from using a role model teachers or educators, will be more beneficial also, because maybe the peers at the same level of the students and with the same level of experience in areas of professionalism. But the research team using a valid way of research, they use a kind of training, using valid skill, training the student how to evaluate each other. Also, they use a nominality and they give feedback. And this feedback are used for benefiting the others of peers. And they notice the improvement of the candidate after hearing from their colleagues about their performance. Also, they use this to measure the improvement of the students from regarding work habits, personal habits, the different skills, and they measured it at the different points, and they measured it at over 3 years. So this kind of methodology is excellent, and the research team should be thanked for this article because they use a new idea, plus they are publishing in Q1 journal like BMC Medical Education. It is a recent article just published 2021 or 2022. So I think I'm right, Dr. Ma, I think 2022.
2020.
Yes, 2020. Okay,
Yes.
so it is a recent article using great methodology. So we need to thank Dr. Maha for the selection of this article, and we thank her for nice presentation. And now we kindly we need to introduce our second presenter today. We have Dr. Fatma Ashraf, demonstrator of medical education, Faculty of Medicine, Suez Canal University. And the floor is for you, Dr. Maha, to talk about the second article today we have.
Thank you, Dr. Smith. If you may please make me a co-host so that I can share my screen.
Okay, Dr. Fatma. Kindly, Dr. NG, help in this point. Now you are co-host, Dr. Fatma.
Okay, thank you. Nice to meet you all. I'm Dr. Fatma Ashraf, Demonstrator of Medical Education at Faculty of Medicine, Suez Canal University. We are going to discuss an article titled Evaluation of an Online Interprofessional Course on Ethics and Professionalism, Experience of Medical, Dental, and Pharmacy Students. First, the authors are Professor Hani Atwa, Dr. Amir Farghali, Dr. Jude Tariq Badawi, Dr. Luay Fadi Malik, and Dr. Asma Abdel Nasser. The study was published in Frontiers in Education in 2024. This is our agenda for today. We're going to talk about the abstract, introduction, aim, objectives, and main questions of the study, the methodology, results, the discussion, and the conclusion recommendations. And we are going to appraise each section of this article. First, for the abstract. Ethics and professionalism in the health professionals education reflect how the health professionals behave reflect how the health professionals behave in practice, and this is based on their professional values and attitudes. The health professions education institutions have implemented many strategies in order to foster the teaching of ethics and professionalism. One of these strategies is the interprofessional education. The aim of this study was to evaluate the perception of undergraduate health profession students about the outcomes of an online interprofessional course about ethics and professionalism, as well as their perceptions of the interprofessional education and the importance of teaching ethics and professionalism in the undergraduate curricula. It was a descriptive cross-sectional study that targeted medical, dentistry, and pharmacy students. The data collection was done through a researcher made 31-item questionnaire that was used after testing its face, content, and construct validity. Descriptive statistics were done using t-tests and ANOVA tests. The results were first for the factor analysis. It yielded 3 factors, which were course evaluation, perception of interprofessional education, and the importance of ethics and professionalism in the health professions education. The participants expressed both the perceptions of all aspects of the course and the interprofessional education. Medical students showed high ratings for the course, for the interprofessional education, and for the importance of ethics and professionalism. In conclusion, the students' positive perception of the online IPE course on ethics and professionalism, as well as the benefits of IPE and the importance of ethics and professionalism, highlights the effectiveness of the course, addressing these important aspects in the health professions education. Now for the introduction. The literature on education of health professionals highlights the importance of teaching and assessment of the principles and concepts of medical ethics and professionalism in the undergraduate curriculum. First, for the medical ethics, is concerned with the morality of medical interventions, as well as the way health professionals should behave as providers of healthcare services. For the professionalism, it's about thinking, behaving, and feeling like a professional, as well as taking responsibility for one's own personal and professional development. The health professional educators argue that it is not sufficient to be implicit. It needs to be included in formal and explicit curricula to be the principles of professionalism and the principles of ethics and professionalism. And this is the only way that professional behavior can be improved. To ensure that the undergraduate students are well prepared in these critical areas, the health professions institutions try to apply multiple strategies, including the IPE strategy. Now that we have talked about interprofessional education, ethics, and professionalism, let's give some idea about the local context where the study was conducted. Ibn Sina National College for Medical Sciences in Jeddah in Saudi Arabia has recently introduced a core course on ethics and professionalism for undergraduate medical, dentistry, and pharmacy students. The main goal of this course was to provide medical, dental, and pharmacy students with the foundational knowledge to identify, analyze, and manage the most common ethical issues and dilemmas, and to practice in a professional manner. The course was taught in an interprofessional context. It was initiated as an online course due to the lockdown in 2020 and the suspension of face-to-face education because of the COVID crisis. The study objectives were first to evaluate the different aspects of the course on ethics and professionalism from the students' perspectives. Second, to explore their viewpoints regarding the importance of learning ethics and professionalism in their undergraduate curriculum. And third, to explore their attitudes towards the interprofessional learning with other healthcare professionals. For the methodology, it was a descriptive study with quantitative cross-sectional study design. A comprehensive sampling that included 4th-year medical students, dental students, and pharmacy students was used. The study was conducted during the academic year 2020-2021. The ethical approval was obtained. For the methodology, first part of the data collection, it was through the researcher developed 31-item questionnaire. It used the 5-point Likert scale. It was disseminated through social media. For the questionnaire validity, the content validity was obtained through 4 medical education experts. The face validity was obtained through piloting the questionnaire with 10 different health professions students. Second, for the data analysis, the data analysis was done through SPSS. The reliability was tested. Construct validity was tested through the exploratory factor analysis. Comparing of the means of different groups was done using the ANOVA test and the independent samples t-test. The level of significance was done with a p-value less than 0.015. Now for the critical appraisal. Were the aims and objectives of the study clear? What do you think? I cannot see if someone has written something in the chat.
No participation. No
Okay.
one. Okay, when Dr. Soha, Prof. Soha replied that yes, the aims and objectives mentioned clearly. Dr. Prof.
Yes.
Abu Ata and Dr. Hadir, many. Dr. Sarah, it was clear. Okay.
Okay. The second question was the study design appropriate for its stated aim?
What do you think about the study design? Waiting your response.
The study aim was to evaluate the students' perception regarding the course, the IPE, and the importance of teaching of ethics and professionalism.
Many of them mentioning yes, and Dr. Hadir mentioned I agree with that as well.
Okay. Thank you all. Was the sample size justified?
What about the sample size used?
The sample size used a comprehensive sample size. What do you think?
Yes, the replying yes.
Okay, yes.
It fits the purpose of the study.
Okay, was the target reference population clearly defined?
In another way, is it clear who is the research was about? The target people or target population of the study clearly defined? Yes, many participants mentioned yes.
Yes, okay. Was the sample frame taken from an appropriate population base so that it closely represented the target reference population under investigation? Was the population appropriate to be sampled from?
Yes, agreed.
Okay, now I will demonstrate my answers. Okay, I agree with you in the first 4 questions. For the 5th question, now for the upper population based, they mentioned that the population based was medical students, pharmacy students, and I can't remember the third type of students. Yes, dental students. Okay, health professions education is not just limited to these 3 programs. So there's nursing students. So I guess it would have been better if more programs were included. Okay, now for the next questions. Was the selection process likely to select subjects or participants that were representative of the target reference population under investigation? The selection process about the
Okay.
I'd like to remind you that it was comprehensive.
Also, it is comprehensive, but it is a questionnaire-based study based on online survey in anonymous way sent to the student anonymously. So they had an involuntary response. So they selected involuntary to share or to give their view about the work by their active participation. So the answer received yes.
Okay. Were the measures undertaken to address and categorize the non-responders? Were there any measures taken to address them?
I think, Dr. Fatma, regarding the response rate, we should mention it because the response rate in this study, non-responded, very few, which is in alignment with what is mentioned in the literature that if when you use an online survey, the response rate not less than 80% of the targeted. So in this study, I think we targeted in the response rate more than 80. Yani, you can compare again for the response rate.
Yes, the response rate is not mentioned here. It will be mentioned in the section after the results.
Okay,
This is
because of
why
that
it's not
means
here.
participant not sure about this point. Okay.
Yes, okay. Okay, where the risk factor and outcome variables measured correctly using instruments that had been trial piloted or published previously.
I think these questions need to be after results because you will ask about the statistical significance 8 and 9 and 10 we can wait after mentioning the results. You didn't present them until now.
Okay, but
Yani from question 7, I
yes.
think we need to wait after results.
Okay, we'll get back to them. No problem.
Yeah, okay.
Okay, let's move to the results section. First, the reliability. The reliability, the Cronbach's alpha coefficient was 0.931. And second, for the construct validity. First, according to the scree plot, 3 factors were retained. The first factor was labeled course evaluation. It had an eigenvalue of 11.24. It explained 41% of the variance in the answers. The items loaded on these factors had values ranging from 0.46 to 0.86. For the second factor that yielded, it was about the perception of inner professional education with an eigenvalue 4.4 and explained 70% of the variance in the answers. The items loaded on this factor had values between 0.3, 0.63 and 0.81. For the third and last factor, it was about the importance of ethics and professionalism for healthcare professionals. It had an eigenvalue of 1.474, explained 9% of the variance in the answers, and the items loaded on these factors had values between 0.48 and 0.87. Okay, for the third part of the results, analysis of the responses of the study participants. First, the response rate was 86. Among medical students, it was 75 among pharmacy students, and it was 66 from dental students. So in total, 207 responded to the questionnaire. 164 students from medical students, 25 students are pharmacy students, and 18 students are dental students. Okay, the first of the descriptive results after the demographic data. Number 1, the positive students evaluation of the course. All the questionnaire items in this for this part had a mean score of 4 or more, which is considered positive student evaluation. And positive students perception of inner professional education also with a mean score of 4 or more. Third, for the emphasis on the importance of ethical training for health professionals, education, and teaching professionalism, also these main scores were 4 or above. There was no statistically significant difference between two genders, males and females, in any of the questionnaire subscales. For the last finding, the participants from the medical program generally provided higher ratings for the course evaluation, perception of the inner professional education, and the importance of ethics and professionalism in healthcare professionals than the participants from the dentistry and pharmacy programs. Okay, now for the critical appraisal, would you like us to go back to the section that was before, after the methodology? Then return to this. Would this be better, Dr. Asma?
Yes, okay.
Okay. Okay. Now,
But we need the active participation of our attendee. We are waiting your participation. I think Dr. Fatma did a great presentation of the article. So we need your participation in the critical appraisal of the article. And we need to learn from all point of view, from all of you. So
yes.
please, first question regarding question number 7.
Were measures undertaken to address and categorize the non-responders?
No, they mentioned the response and but they
Yes.
didn't mention what they did with the non-response students, because I think it is in a voluntary response, so no, and no pressure on the student to participate.
Yes, that's my opinion too. Were the risk factor and outcome variables measured correctly using instruments that had been tried, piloted, or published previously? I guess that's an easy question.
It should be. Okay, waiting your response. Waiting all of you your response regarding this part.
Okay, to make it easy, the study, they did content validity, they did phase validity through piloting, and they did construct validity through the exploratory factor analysis.
Excellent.
So, yes, so we can trust the instrument they used. Okay, for the next question, is it clear what was used to determine the statistical significance and precise estimates?
Waiting the responses. Yes, many answers regarding this question. Yes, it was.
Okay, great. Were the methods sufficiently described to enable them to be repeated? Did they mention the statistical tests they have used?
Many responses, yes.
Yes, they did. Okay. Okay. Now, were the basic data adequately described?
The basic data of the participant, yes, we received the answers from our attendee. Now they are very active, mashallah. Yes, many
Yes.
responses from different doctors. Yes, okay.
Okay, they described the basic data adequately. They showed the males and females, and they showed from which programs they are. Okay, does the response rate raise concerns about the non-response bias? The response rates were, I guess, above 80 for the medical students, 75 for the pharmacy students, and for the, what was the last one again? Dentistry students, I guess, the
Yes,
dentistry students was 66.
maybe to some extent.
Okay, why do you see that?
Dr. Hadir replied.
Hello.
Hello.
Hello,
Hi.
Dr. Hadir.
Well, I'm not sure why I felt like the response rates were higher in medical students than pharmacists and dentistry students. So I don't know why is that, but I guess this diversity or these different response rates might affect the final results. Yeah.
Yes, I'd also like to add this. Yeah, that was my point too. The high response rate was in among medical students, which originally represented the higher percentage of participation.
Actually, I have answer for this because I'm one of the authors, and because this article, يعني regarding this research work according to the number of registered students in the course. Number of medical student is higher in the medical program more than the pharmacy and the dentistry. So the response, it is a mixed response, يعني relative sampling. because number of medical students higher than these two professions, and actually not including nursing, because nursing not included in this IBE course.
Okay, okay. It's great to have one of the authors in the journal club.
We should invite.
Okay. If appropriate, was the information about the non-responders described?
We answered regarding this point, Dr.
Yes.
Fatma. I think we are now in the where the results internally consistent. Question 14 now.
Yes.
Mm.
Where the results internally consistent, I'd like to remind you that the Cronbach's alpha was calculated.
Yes.
Okay.
There is answers from Dr. Tahani, yes.
Okay, where the results presented for all the analysis described in the method? Yes, it was.
Yes.
Okay.
Dr. Sarah, yes, I think, and we, Dr. Hadir and Dr. Tahani, many replied.
Okay, thank you all.
Okay.
Okay, now for the discussion. Just 1 minute. Okay, the students' positive evaluation of the course was consistent with previous research on the effectiveness of online IPE courses for the health professions students. The authors attributed this student satisfaction with the course to the diversity in teaching and learning methods within the course, creating a community-like environment, and the role of facilitators as IPE role models. The students showed positive perceptions of IBE as a learning strategy for teaching ethics and professionalism, which was in congruence with several previous studies that highlighted the importance of IPE and the perception of undergraduate health professions students of it. For the participants, positively perceived importance of ethics and professionalism. This was attributed to the vitality of teaching ethics and professionalism to undergraduate healthcare students, which was highlighted in several previous research studies. The course was equally well perceived by both males and female participants. This finding is congruent with Heinen et al. 2007 and Reynolds 2003. They found no substantial differences between males and females' perception of IPE different courses. These findings suggest that gender does not play any significant role in shaping participants' perception of the IPE course, inner professional education, or their recognition of the importance of ethics and professionalism in the healthcare. However, Williamson in 2011 and Suleiman in 2021 reported that female students in general viewed inner professional learning more positively than the males. In this study, medical students provided more positive ratings for the course evaluation, the perception of IPE, and the perception of importance of ethics and professionalism for healthcare professionals as compared to the dentistry and pharmacy students, while Heinen et al. 2007 found no profession-related differences in regard to the perception of IPE. On the other hand, Suleiman et al. 2021 reported that pharmacy students had significantly higher scores on their readiness for IPE than medicine, dentistry, and applied medical sciences colleges. These contrasting findings suggest that the profession-related preferences might depend on the context of the course, the content of the course, and the effectiveness of implementing the IPE activities. The IPE course in the current study was conducted online. This is believed to overcome many challenges related to IPE, such as the shortage of time, the lack of resources, and the difficulty in synchronizing the timetables. Now we will discuss some of the limitations of the study. Number one, not all health profession students were included, such as nursing students. Number two, the study measured only one level of the evaluation. It measured only the student's perception. Number three, it was a descriptive cross-sectional study. Other factors that might have accounted for these differences between students of different programs remains unexamined. And fourth, the data were collected through the questionnaire, which might be subjected to response bias. Last, in-depth qualitative data would have been more useful for the triangulation of evidence. In conclusion, the student positive perception of online IPE course on ethics and professionalism, along with the recognition of the importance of ethics and professionalism and interprofessional education, highlight the course effectiveness in addressing such important aspects of the health professions education. These findings support the integration of similar courses into health professions curriculum. Incorporating ethics and professionalism education through IPE can foster the development of competent and ethical healthcare professionals and ultimately improving the patient care and patient outcomes. Now we will critically appraise this last part of the article. For the first question, were the author's discussions and conclusions justified by their results? What do you think?
Many responses in the chat. Yes.
Yes, they were justified. Each part of the discussion was, in each part of the discussion, the results related to it was mentioned and it was justified. For the next question, were the limitations of the study discussed? Yes, they were discussed. I just discussed them. Any other? Okay.
Many said yes.
Okay.
It's really discussed.
Okay. The next question, were there any funding sources or conflicts of interests that may affect the author's interpretation of the results? I do not know if I have mentioned it in the presentation, but it was mentioned in the articles that was no any source of findings and there was no any conflict of interest.
Yes.
Okay.
It is mentioned in the article, yes.
Yes, it is mentioned. It's my fault, actually. Okay, was the ethical approval and the consent of participants attained?
There is answer from Dr. Maha, yes, there is ethical approval.
Okay. Okay, thank you. Okay, I would like to thank you all for this rich discussion.
Please, Dr. Fatma, bring the first slide of your
Yes.
presentation.
Of
Thank
course.
you, Dr. Fatma, for your nice presentation. We enjoying with you and Dr. Maha the discussion today in the Journal Club, and also we enjoyed with our active participants. They are very cooperative with us in this session, and we need to have any kind of feedback from all of you, or you have any remarks, point, or you need to add for us any kind of feedback about the session, and or you need to give any idea about the article discussed today, about the selection of the articles. And by the way, the second article was presented in Frontiers Q2 article index, the journal. It is published recently 2024. So we encourage, we thank our invited presenters today, Dr. Fatma and Dr. Maha, for selecting good articles, recent articles from high-ranked journals like PMC and Frontiers in education. And we need to thank all of you for your attendance today with us. And if you have any kind of comments, and if you need to share any kind of any kind of feedback, many thanks today. Thank you for all attending, for their great remarks. Many thanks from all of you for your attendance today with us. We are happy with all of you, and we encourage, waiting all of you to attend the next journal club. We will announce about it very soon. It will be an enjoying topic and waiting us. Thank you for all of you for your attendance. Thank you, Prof. Dr. Hind Abulata, my colleague in Journal Club Coordination, and also big thanks for Dr. Inja Buzaid, the coordinator of the research committee, and also she is the great moderator of all activities running in Egyptian Society for Medical Education related to the research committee. Thank you for all of you for your attendance, and have a nice day. Thank you. Goodbye.